Why is dental health so important, and how can dental prosthetics play a role in it? Well, let's delve into that. Our dental health is a mirror to our overall well-being. It's about more than just a captivating smile or being able to crunch into an apple. Oral health serves as a gateway to our body, and poor dental health can lead to serious complications such as heart disease or diabetes. Now let's talk about missing teeth. They are not just an aesthetic issue. When you lose a tooth, it disturbs the balance in your mouth, causing other teeth to shift, leading to a domino effect of dental problems. This is where dental prosthetics come in. They fill in the gaps, restoring function and preventing further complications. So dental prosthetics can play a vital role in maintaining our oral health by replacing missing teeth. But what types of dental prosthetics are available? Dental prosthetics come in various types, each designed to address specific needs. Let's delve a little deeper into this fascinating world of dental prosthetics. First off, we have dentures. These are removable replacements for missing teeth and surrounding tissues. Dentures can be either full or partial, depending on whether they are replacing all teeth or just a few. The installation process involves taking impressions of your mouth, creating a denture model for adjustments, and then, finally, crafting the final denture. The primary benefit of dentures is their affordability and non-invasive nature. Next up, we have dental bridges. As the name implies, these literally bridge the gap created by one or more missing teeth. A bridge is made up of two or more crowns for the teeth on either side of the gap, with false teeth in between. The installation process involves preparing the teeth on either side of the gap, creating a model bridge, and then cementing the final bridge into place. Bridges offer a fixed solution that is less likely to move or shift in the mouth, providing a more natural feel. Last but certainly not least, we have dental implants. These are the most advanced form of dental prosthetics. Implants involve inserting a titanium post into the jawbone, onto which a replacement tooth is then attached. The process is more involved and requires several visits to the dentist, but the end result is a highly durable, natural-looking replacement that functions just like a real tooth. The primary benefit of implants is their longevity and their ability to prevent bone loss in the jaw. To sum up, dentures offer a cost-effective solution for tooth loss. Bridges provide a fixed and natural-feeling option, while implants give the most permanent and natural-looking result. Each of these options has its own unique benefits and is best suited to different situations. As we can see, each type of dental prosthetic is designed to cater to a specific need or situation. Now that we understand the different types of dental prosthetics, how are these prosthetics installed? Like a well-choreographed dance, the installation of dental prosthetics involves a series of carefully planned steps. However, it's important to remember that the precise procedure can vary depending on the type of prosthetic in question and the individual's specific needs. Firstly, an accurate impression of the patient's mouth is taken. This can be likened to a map, guiding the dental technician in crafting the perfect prosthetic. This model of the mouth provides a detailed view of the area where the prosthetic will be placed, allowing for an exact fit. Once the prosthetic is ready, the dentist prepares the area for placement. This might involve reshaping the surrounding teeth or even bone grafting in more complex cases. The aim is to create a stable and suitable environment for the new addition. The next step is the actual fitting of the prosthetic. The dentist ensures that it sits comfortably and aligns correctly with the surrounding teeth. Sometimes, minor adjustments might be needed to ensure optimal fit and comfort. This is a delicate process, akin to fitting a piece of a jigsaw puzzle in the perfect spot. Now, not all prosthetics are permanent from the get-go. Some, like dentures or certain types of bridges, are removable and may require a period of adjustment. The patient might need to learn how to properly insert and remove them, or how to adapt to eating and speaking with them. Lastly, there's the follow-up. After the fitting, the dentist schedules regular checkups to monitor the prosthetic's performance and the patient's comfort. This is the dentist's opportunity to make any necessary adjustments and to ensure that the prosthetic is functioning as it should. In essence, the process of installing dental prosthetics is a balance between science and art. It's a journey that requires precision, patience, and a keen eye for detail. Though the procedure can vary, the ultimate goal remains the same: to restore function and aesthetics to your smile. Let's summarize the key points about dental prosthetics. Firstly, we've established the importance of dental health. It's not just about having a dazzling smile, but also about overall well-being. Poor dental health can lead to a host of issues, from gum diseases to systemic health conditions like heart disease and diabetes. Now let's talk about dental prosthetics. These are artificial substitutes that replace missing teeth, restoring both function and aesthetics. They come in various forms, each designed to cater to specific needs. Whether it's a single tooth or an entire set, dental prosthetics have got you covered. Dental implants, for instance, are a long-term solution that replaces the root of the missing tooth. Then we have dental bridges, which are ideal for replacing one or more missing teeth in a row. Dentures, on the other hand, are used when most or all of the teeth are missing, and they can be either complete or partial. The procedure for installing dental prosthetics typically involves careful planning, preparation of the mouth, and the fitting of the prosthetic. It's a process that requires precision and expertise and is usually carried out over several appointments. But what's truly remarkable about dental prosthetics is the benefits they bring. They don't just fill gaps, they restore your ability to eat, speak, and smile with confidence. They can give people a new lease of life, boosting their self-esteem and improving their quality of life. Moreover, dental prosthetics also help maintain the structure of your face and jaw. When you lose teeth, the surrounding bone can start to deteriorate, leading to facial sagging over time. Prosthetics can prevent this, helping to keep your face looking youthful and healthy. In conclusion, dental prosthetics offer a solution for those struggling with missing teeth, providing both functional and aesthetic benefits. They play a crucial role in maintaining good oral health and improving overall well-being. Dental prosthetics truly are a marvel of modern dentistry, providing solutions for those struggling with missing teeth and helping to maintain good oral health.